The thought process towards people of African descent has always been and continues to be that we're less than. And so this notion or feeling of being less than drives public policy, which contribute to poor health outcomes for our people. The social determinants of health are the non-medical factors that influence health outcomes. They are the lived conditions in which people are born, in which they grow, in which they work, in which they live, and in which they age. These forces are systems. They are important influence on health inequities and the unfair and avoidable differences in health status seen within and between countries. The lower the social economic position, the worse the health. For every dollar of wealth an African American may have, whites will have $18. So that is a huge economic barrier, an economic disparity. So it's not about necessarily the individuals who represent these systems, but the systems itself are what drive the inequalities. And so what we have to focus our energies and attentions on is the systemic changes that are necessary in our communities to make sure and ensure that every individual, and especially those in the African American community who have suffered from years of historical and generational trauma as an outcome of enslavement and all kinds of policies and laws that have been a constant threat to our very existence. Storytelling is part of our tradition, and we're going to tell our story from our perspective, right? To communicate clearly how these policy changes and others will help bring quality of life, of peace and prosperity. We're under too much stress. Just being Black in America is a stressful experience. We have to change that. And that's what we're committed to doing here in our Igniting Hope podcast today. We're going to invite you to join us in this movement to bring health equity to our community. It's never been done in America. Well, now is the time. Now is the time. So this is Pastor George Nicholas, Chair of the Buffalo Center for Health Equity. Well, we're so grateful that you took the time today, and we're going to have some exciting guests, some exciting people who are doing some great work, not only in Buffalo, but around the country, that are going to be joining us for some very important conversations as we build a community of hope, a community of caring, and a community of equity.